I'm Dr. Paul Zwiebel. I'm a plastic surgeon here in Highlands Ranch, Colorado. I wanted to talk with you today about a question that gets asked a lot lately about the different shaped implants. And the question that comes up is, what is the right implant for you? So I wanted to fill you in a little bit on some great new technology that's evolved over the last several years and really has changed dramatically the way that we as plastic surgeons figure out the best implant to give you the best possible result. The nice thing is that with all these different implant choices, we really can custom fit the implant to an individual to give a much more refined result in terms of the shape that you might be looking for. That also lets us give a much more natural result. It can seem confusing because there are so many different shapes, but that's really our job. Our job is, during the course of our consultation, to find out from you what it is you're looking for, and then integrating with that an examination where we look at the shape of your breast to start, the size of your rib cage, and use all this information to come up with a good plan for you. Let me show you some examples of the different shapes that we have. If we look first at what we call a round implant or a spherical implant, these are smooth in surface, and these particular implants here are demonstrating a difference between a low, a medium, and a high profile implant. You can probably tell from there that even though these are the same width, as we go from here to here, they're taller, fuller, rounder. What's happening here too is that the volume is actually increasing since these are taller implants, and so we have a jump of about 75 to 100 cc's as we go from low to medium to high. This very clearly is going to make a difference in the shape of the breast. One of the things that's really great about this too is that this actually gives us the opportunity to have the implant fit the chest better. So during our consultation, one of the things that I'm going to be doing is actually measuring your rib cage. We have a certain amount of space that goes from the breastbone to the side of the chest, and that's really the footprint where the implant has to fit. If that implant is too wide, that's going to create problems with lateral fullness, and one of the other problems is that when you lie back, if the implant's too wide, it'll shift to the side rather than staying up in the chest. So this proper fitting of the implant is key. By the same token, if the implant is too small for the chest, it won't harmonize well with your natural breast tissue to really give you an optimal result. So that's one of the things that we're going to figure out during the course of consultation. Another really exciting option that we have is that we actually have shaped implants that are teardrop in shape. And I'm showing just two of the possibilities, but believe it or not, among all of these round and teardrop shapes, we probably have about 20 or 24 different potential shapes. The good news again is that that really gives us a lot of opportunity to customize the fit for you. With these teardrops, what you can see is that they actually have a teardrop shape rather than a round shape when you look at them in profile. You'll also notice that there's a difference between a smooth and a texture, and I'm going to talk about that in a different video. Today I just wanted to give you an idea of what some of the differences may be. For example, here with the teardrop, you can see that this has a more gradual slope, whereas this provides more projection. And again, different option in terms of shaping, depending upon the breast you start with, the shape of your rib cage, but also the aesthetics that you're looking for. Now, one of the other things that's really nice that we can do for you during the consultation, after we get all of the sense of the aesthetics that you're looking for, we have our measurements, we might come up with 2 or 3 different options in terms of a round implant or a teardrop. The other great technology that we have is a 3-dimensional imaging device. So at the end of our consultation, we're going to choose the size and shape of implants that during our consultation we thought might be the best fit for you. And we're going to actually load those up in the 3-dimensional imager. So when we're done talking and examining, you'll be able to go in front of our computer screen and actually see what those choices will look like in your own body. And it's an incredibly valuable tool so that you can see what the result might be if, for example, you had a low profile round implant or maybe a high projection teardrop. So anyway, I look forward to the opportunity to talk with you, find out what your aesthetic goals would be for breast augmentation, and actually be able to demonstrate for you the kind of results we can get. So please give a call. I look forward to seeing you in consultation.